I am Dr. Jagannathan. I have a YouTube channel, Jagan Medispree, where I'll be discussing topics on spirituality, Anmigam, and medicine. So my channel is called Medispree, and the name of the channel is Jagan Medispree. Today I am going to discuss about chest pain because chest pain is a common topic. Chest pain is an alarming topic. Chest pain is a thing that is feared by most of the people, or not most of the people, everybody. If somebody experiences chest pain, there is extreme alarm and they're so much worried. So it's an important topic. Anyhow, it's an elaborate topic, so I cannot discuss this elaborate topic within a short period of time. So now I am going to discuss about one aspect of chest pain, that is chest pain of the heart, cardiac chest pain. Or popularly people think all cardiac chest pain is heart attack. It's not so. Anyhow, I'll explain all these things. Now, chest pain is a sign. It's which most of the people think it is an alarming sign. Yes, it may be an alarming sign when there is a uh, dangerous disease, dangerous problem like a heart attack or say, a rupture of a vessel or there's a bleeding. All these things are there. So it may be alarming, but all chest pain are not cardiac chest pain or heart pain. Most of the time, people think all chest pains are cardiac pain. It is not so. Now, the chest pain, most of the time, it may be cardiac pain. It may be pain due to respiratory diseases. It may be due to digestive diseases. It may be due to problems in the bones and muscles. And there are other aspects like physical and mental health problems. All these things can cause chest pain. Chest pain should always be taken seriously because it is always better to err in the wrong side. Even if it is mild or even you don't think it is not life threatening, you have to consider it seriously. Now, learning to recognize when chest pain should be treated as a medical emergency and when it should be reported to your doctor for your next appointment could help you to prevent major medical complications and even death. So you should be able to differentiate which chest pain is an emergency, which chest pain is not an emergency. That I will tell when I explain these things, you may be able to a certain extent, you will be able to understand that. But anyhow, whenever you get a chest pain, always immediately take medical help. That is most important. You yourself cannot assume, no, this is not a heart pain, this is only gas, this is this thing, this is that thing. No, you should not assume, you should not neglect chest pain. You have to, until it is proved and ruled out that it is not heart attack, not cardiac pain, or not a serious chest pain, you have to have the medical opinion and medical advice. Okay. Now, what are all the, suppose you have chest pain, and what are all the other, chest pain does not come alone. Most of the time it comes with other associated symptoms also. When you get chest pain, you don't only chest pain, you get other associated symptoms also. So, certain associated symptoms are or will definitely tell you your chest pain is not ordinary pain. It is you need an emergency treatment. So, what are all the other associated symptoms that may come with chest pain to note to say your chest pain is a serious condition? Now, one is shortness of breath. When you have chest pain and you have a difficulty in breathing, and there is a difficulty in you are not able to breathe well, then it's a dangerous situation. Or you have nausea, that is vomiting sensation. You have lightheadedness. You feel you are flying, or so you are flying. You are feeling like falling down. These things, and extensive sweating, chest pain with the sweating. These are all some of the associated signs with chest pain, which indicate that your chest pain is a serious condition. Anyhow, in this discussion, I am going to talk only about heart-related causes. Pain, chest pain, due to heart and other related structures. I am not going to deal with other things which we may take some other time. Now, the heart pain, there are several causes for heart pain. The first, but the most important one, dangerous one, is heart attack, isn't it? That is what is heart attack. I will tell you next. First, before heart attack, you get a heart pain, that is angina. Angina is mild heart pain. The mild heart pain, it comes when the oxygen supplied to the heart is diminished. When the oxygen supply, the blood is heart is diminished, you get angina. So angina is a chest pain of milder nature, but you must remember angina may progress to heart attack and even death. Okay, that is it. Angina is not ordinary thing. As such, angina is maybe mild. When the angina is mild, you have a mild pain. You have the pain will be just something like squeezing, something like pressing your chest, or something like burning. All these things, all these type of symptoms, milder symptoms will be there. Angina comes when there is a disparity between the demand and supply of oxygen to the heart. For example, if a heart needs 100 cc of oxygen normally, and you get only 70 cc, the heart is starved of oxygen, so you get chest pain. This is one situation. In another situation, your heart not which normally requires 100 cc, sometimes it may require 150 cc in certain situations. For example, you are doing a hard work, strenuous exercise, running, all these things. Then that situation you may need more oxygen. In that case, even if you get normal oxygen, that is 100 mcc, that will not be sufficient, then also you get angina. So it is only comparative phenomena. Angina is a comparative phenomena between demand and supply. So the demand and supply should be equal. When there is a disparity between the demand and supply, you get angina. Angina, there are two types. One is a stable angina, other one is an unstable angina. So what stable angina means, see, whenever you strain, whenever you do some strenuous exercise, whenever there is an increase in the oxygen demand because of overactivity, then you get the pain. That is stable angina. So that can be relieved by taking rest. When you take rest, the necessity for the increased demand comes down, so the angina will go. But there is another situation, it's called unstable angina. Unstable angina comes at any time. Even you are resting, even sometimes you are sleeping, you are totally at rest, then you get angina. That is the chest pain. And this unstable angina is not due to reduction in the oxygen, it is due to reduction in oxygen, but the reason is not the increased demand, but there is a spasm of the heart vessels, coronary arteries. So they undergo spasm, the lumen of the vessels decreases. So the blood supply also decreases. So even you are not when you are not even at rest, the blood supply is reduced. So you get unstable angina. Unstable angina is a very serious condition that unless you recognize it and you treat it properly, you may end up with heart attack and even sometimes death. Okay. Next, second most important cause of chest pain, cardiac pain is heart attack. Heart pain associated with heart attacks is sharp, throbbing pain, tightness or pressure. The pressure means heavy pressure over the chest. Heart attack occurs when there is a block in the one or more of the arteries. There are usually 3 arteries supplying heart muscles. But if one, two, or three, any of the arteries is blocked severely, then you may go in for heart attack. When muscles, just like when the muscles in the body are starved, the muscles get pain. When they're starved of oxygen, they get pain. Similarly, heart muscle also, when it is starved of oxygen, that gets pain. And the starvation of the cardiac muscle of oxygen is very heavy. The heart muscle suffers, it decomposes, even it dies. It dies. It injures, it gets injured and it dies. The death of the heart muscle, part of the heart muscle is called myocardial infarction. That is commonly called as heart attack. The chest pain that occurs with a heart attack may feel like a sharp, throbbing pain, or it may seem more likely a tightness or pressure in your chest. Other heart attack symptoms include there will be difficulty in breathing, lightheadedness, extensive sweating, nausea, the vomiting sensation, irregular pulse. Your pulse will become irregular and the pulse become faster. Your tachycardia, the pulse rate becomes 150 or so. You feel there is a lump blocking you, choking your throat, and there will be signs of shock. Your BP will fall down. You may become unconscious and even go for coma. And there is vague feeling that something is wrong, and the feeling of death. All these, a fear of death. All these things occurs in the case of heart attack or myocardial infarction. Okay. Now there is another situation. The third condition where you get cardiac chest pain is myocarditis. The myocarditis means inflammation of the heart muscle. Myocardium means heart muscle. The inflammation is called myocarditis. Chest pain with associated myocarditis is mild pain or feeling of mild pressure. So it's not a very serious. It is not a very serious condition unless it is going to proceed for coronary artery heart disease. So the pain will be minimal and it feels like a pressure. In some cases, heart-related chest pain is caused because of the inflammation of the heart muscle, most frequently by virus. There is a particular virus which frequently attacks the heart muscle, and then you get viral myocarditis. This is myocarditis. In viral myocarditis, the chest pain, there is a mild chest pain, not very severe. There is a chest pressure. There will be difficulty in breathing, and there will be swelling of the legs, and there is the palpitation. That is, the heart rate will be very fast. Heart rate will be more than 100, 120, 130. The swelling in the leg is called edema. That is because your heart goes in for failure. When the heart goes for failure, you got edema. Then fourth condition is pericarditis. Chest pain associated with pericarditis, that will be sharp or dull pain that usually starts in the center or left side of the chest. This also is another type of inflammation. This is called pericarditis. The last one we see myocarditis. Myocarditis is inflammation of the heart muscle. Pericarditis is the inflammation of the covering of the heart. The covering of the heart is called the pericardium, and when that is infected, that is inflamed, we call it as pericarditis. It is specifically an inflammation of the thin watery sac surrounds the heart, that is called the pericardium, and it may be caused by viral or even bacteria also. Usually, myocardial bacterial infection is more common in the pericardium. Here, heart surgery can also lead to pericarditis. In most cases of pericarditis, cause is unknown. See, when people undergo cardiac surgery, heart surgery, so there's a possibility of infection occurring at the pericardium. And most of the cases, the cause is not known. This condition is not very frequent, and it occurs there. This pericarditis is associated with fatigue, that is weakness, dullness, muscle ache, and mild fever. Now, the symptoms of pericarditis will disappear with the treatment in a short duration. So it's not a very serious condition, but anyhow, it's a heart problem. Next one is aortic aneurysm. Chest pain associated to aortic aneurysm may be may not cause a noticeable symptom, or the chest may feel tender or touch. What it says is there may not be severe chest pain, but there will be tenderness. Tenderness means when you press your chest or back, you will feel the pain. See, the aorta is a large artery that is supplying blood to the whole of the body from the heart. Sometimes what is the aneurysm means there is a dilatation of the or thinning of the and the blood vessel wall so that it bulge out. So as when the blood is passing through it, it bulge out. For example, when you pump a cycle tube, sometimes when the weaker part of the cycle tube will bulge out separately, isn't it? Likewise, the bulging out of the aorta is called aortic aneurysm. This aortic aneurysm, it's also a very serious condition, but for most of the time it may not be having so much of symptoms, excepting there may be tenderness in the back or chest or abdomen, as I told you. There may be cough, there may be shortness of breath. Otherwise, visible pain may not be there until some complications develop. Okay, next, aortic dissection. Okay, aortic dissection means I told you aorta is the large vessel that is supplying the blood to the whole of the body. So now the aorta has got three layers. The aortic wall got the three layers. Sometimes there occurs a small tear in the wall, and blood will accumulate in the wall in between the one of the three layers. In between the layers, because the blood won't come out, but within the wall of the aorta, within the layers, the blood will accumulate. What will happen? Subsequently, it may rupture. That may tear. The tear may open up, and there will be massive bleeding and death. So that has to be aortic aneurysm is a very serious condition, almost fatal condition, which has to be recognized, which has to be treated urgently, and the aortic dissection pain is very sudden, sharp, constant pain in the chest and the upper back. It's a sharp pain, sudden pain, constant pain. Pain may be also in the arm and the jaws, and there will be trouble in breathing, and there will be other associated symptoms like fainting, fall in blood pressure, increase in pulse rate, all these things. Okay. Now, seventh cause is cardiomyopathy. Cardiomyopathy means cardio means heart, myo means muscle, padi means disease. So, disease of the heart muscle, that is called cardiomyopathy. So, this may be due to so many causes. Cardiomyopathy may be due to infection, maybe due to rupture, maybe due to injury. So, there are viral infection, or there are a lot of valvular heart disease. So, that may occur due to so many reasons. In that case, you have shortness of breath, breathing difficulty, swelling in your leg because of the prolonged heart disease, chest pain, which may be more increase with the exertion after eating or a heavy meal, and heart palpitation, that is increase in the pulse rate, and irregular heart rate. The heart rate will be irregular. So that is cardiomyopathy. The last one is valvular heart disease. The valvular heart disease is there are four valves in the heart: mitral valve, tricuspid valve, aortic valve, pulmonary valve. All these valves are doors of the heart. The heart has got communication between upper to lower chamber, isn't it? So, and heart to outside. So there are four exit points where four valves are there. Whenever there is a problem in the valves are diseased, especially rheumatic fever, rheumatic disease, or autoimmunological disease, or even sometimes the valve may be by birth itself damaged. In all these situations, the heart will be affected, and the circulation will be affected, and you may have chest pain. So these are all the 8 causes of cardiac chest pain. So I stop with this. We have to elaborately see each one. So next topic we will talk about the heart attack, where I will elaborate everything about heart attack. Thank you.